All right, let's jump right in. We all kind of know that health is connected to, well, everything. The economy, our environment, our schools. So why is it so ridiculously hard to get all the different parts of government to actually work together on it? Today, we're going to break down a really powerful new way of thinking that could be a total game changer.
And yeah, this is the big question, right? I mean, the health sector can't fix everything by itself, but trying to get the transportation department or the education folks on board often feels like pushing a boulder uphill. So let's dig into why that is, and then explore a brilliant little shift in perspective that might just be the key.
So first things first, we have to look at the way we've always done things and pinpoint its hidden flaw. For decades, the main strategy has been something called health in all policies. It sounds fantastic, but it's got a fundamental bug that often stops it right in its tracks.
So this idea, health in all policies, or you'll hear it called HIAP, is on paper a brilliant concept. It basically asks every other part of the government, from environment to finance, to just stop and think for a second. Hey, how will our decision here affect people's health? The goal is to work together and, try not to cause new problems.
Okay, but here's the problem. In the real world, Health Ape often comes across like the health sector knocking on everyone else's door saying, hey, could you all please change your plans and your budget to help us solve our problems? And politically, that is a super tough sell. It makes health feel like a burden, not a shared goal.
So if that's the problem, what's the solution? This is where it gets really exciting. We're talking about a complete shift in mindset, moving away from asking for favors and toward building partnerships where everybody benefits. It's a subtle but powerful change to something called health for all policies.
And this slide just lays it out perfectly. On the left, you've got the old way, HIAP. It's basically a one-way street. But on the right, you have health for all policies. And the game changer is the direction of the arrow. It's not just what can you do for health anymore, it's what can health do for you. It's a two-way street, a genuine win-win.
And the engine that drives this entire new approach is one simple but profound idea: co-benefits. These are the awesome ripple effects from health policies that create wins for other sectors too. You can think of it like making a single investment that pays off dividends in education, the economy, and the environment, all at the same time.
So how does this actually work in the real world? I mean, these co-benefits don't just appear out of thin air. They actually pop up through two very different but equally powerful pathways. And understanding these two paths is the key to unlocking the whole thing.
Okay, let's break this down. The first path is the direct one, the one we usually think of. When people are healthier, everything else just works better. Kids do better in school, adults are more productive at work. It makes perfect sense. But the second path is indirect, and honestly, it's a giant. The health system itself, the hospitals, the clinics, is a massive economic and social engine with a huge footprint.
And we really can't overstate just how massive this indirect path is. In most countries, the health sector is one of the biggest players in the entire economy. The choices it makes about what it builds, who it hires, and what it buys sends huge shockwaves through everything else. The next couple of stats are going to make this crystal clear.
I mean, just look at the money. In a country like the United States, health spending makes up nearly a fifth of the entire economy. That is a mind-boggling amount of economic power concentrated in one place.
And it's not just cash, it's jobs. In places like Norway or the Netherlands, the health and social care system employs 1 out of every 5 workers. Think about that. It's a critical engine for employment and keeping the economy stable.
But, and this is a big but, that huge footprint isn't all good news. The health sector is also a major source of pollution. In some countries, it's responsible for over 8% of all carbon emissions. Now, here's the twist. Seeing this number reframes the problem as a massive opportunity. It's a clear-cut co-benefit just waiting to happen. A chance to improve health and smash our climate goals at the same time.
So let's bring this down from the 30,000-foot view and make it really concrete. Let's just zoom in on one single hospital. It's the perfect example of how one institution's choices can either create a bunch of negative side effects or generate really powerful, positive co-benefits for the entire community.
So, when a hospital is planned with blinders on, just thinking about its own operations, it can cause all sorts of headaches. Its energy use adds to climate change. If they build it way out on the edge of town, it creates traffic and sprawl. It can waste tons of resources, and even its hiring practices can make local inequalities worse.
But what if we just flip the script? A hospital that's designed to create co-benefits becomes a powerful force for good. It can be the anchor for a walkable, green community. It can be a leader in fair hiring practices, run on clean energy, and buy from local, sustainable businesses. This isn't some fantasy, it's a choice.
Okay, so this idea is clearly powerful. It's a total no-brainer, right? But we all know how the real world works. How on earth do you push these brilliant win-win ideas through the messy reality of politics and bureaucracy?
Well, somebody actually made a roadmap for this. This little chart here is genius. It helps you map out the political landscape. You've got things that are important and things that aren't, and things that cause a big fight versus things people mostly agree on. The sweet spot, the place to start, is right there in that bottom left box. Something that leaders care about, but that isn't going to cause a huge political war.
So the big takeaway here is about strategy. It's not about trying to fight every single battle at once. It's about being smart, finding those high-impact, low-drama issues where you can get an easy win. You start there, build some momentum, and then you tackle the harder stuff.
And once you get that win, how do you make sure it actually sticks around? Well, there are tools for that too, like this TAPA framework. It's basically a checklist for good policy. Is it transparent? Is someone accountable? Can people participate? Does it have integrity, and do we have the capacity to actually do it? It's a super practical way to build policies that are meant to last.
And if ever there was a time for this kind of thinking, it's right now. This quote just nails it. The pandemic was a brutal reminder of just how connected everything is. It was a huge setback, sure, but it also shined a massive spotlight on why this co-benefits approach is so essential for building back stronger.
And you know what? The best part is, we don't have to invent this from scratch. We already have a global playbook, the UN's Sustainable Development Goals. The SDGs give everyone, from health to education to urban planning, a shared language and a common set of goals. It makes it so much easier to spot those win-win connections.
So, I'll leave you with this to think about. If we just shift our question from, what can you do for health, to what can health do for you? What incredible untapped potential is just sitting there, waiting to be unlocked in our own communities? What hidden co-benefits could transform our world for the better? It's a powerful thought. Thanks for tuning in.